is we've gone the wrong way, baby. What's not been fully documented, understood, or explored, and it's the subject of my upcoming book, is that while women have gained equality in many arenas, they've also begun to close the gender gap when it comes to alcohol abuse. Women with a university degree are almost twice as likely to drink daily as those without, and they are also more likely to admit to a drinking problem. In fact, the one protective factor for women, a low-status occupation. Those in high-status occupations working in male-dominated environments have an increased risk of alcohol use disorders. That's an amazing fact. Those born between the years of 1978 and 1983 are the weekend warriors who drink to blackout. In that age group, there's a sharp reduction in male drinking and a sharp increase for women. Women in their 40s and 50s have a very high risk in terms of heavy drinking and weekly drinking. And this comes from Catherine Keyes of Columbia, who reviewed 31 international studies of birth cohort and gender differences in alcohol consumption and mortality. Preeminent American researcher Sharon Wilsnack, who's really the figure in terms of looking at women and alcohol, says what we're witnessing is a global epidemic in women's drinking. She says, when I got into the field in the early 80s, there wasn't this huge epidemic. Heavy alcohol use, like smoking, used to be such a male prerogative. Well, now it's a female prerogative, and we're running with it. Sheryl Sandberg says, lean in. Well, we are leaning in, ordering another round. The downside is enormous to this new normal. As one doctor at Hazelton told me, politically men and women are equal, but hormonally, metabolically, we're different. And this has huge implications. Others have covered what this means in terms of women's chemistry, in that we become more dependent on alcohol much faster than men. Cognitive deficits, liver disease, and other consequences all happen earlier in women. Breast cancer has been mentioned. Alcoholism is a more serious risk for early mortality than smoking, and more than twice as deadly for women as for men. When I got to Queen's Campus, which has definitely identified, it has a chair in anti-stigma and is identified itself with making mental health a real priority, I asked this very smart group of student leaders that I went to lunch with, would you know the sign of someone becoming alcohol dependent? They could name the 5 things if someone was getting into trouble with depression, but they couldn't name a problem. And one of them said to me, do you think one of my roommates every morning drinks beer in the shower? Do you think that's a sign of something wrong? I said, yeah, probably. I think we are in that strange cultural blip where we believe that it's a rite of passage. This is something one should expect, and the problem is it may be a rite of passage, but people die.